I think I have two questions actually, based on the fever you had spoken about and the vitamin D. So the first one, you had mentioned that that fever is actually a way of fighting off infection, right? So when I've heard of situations where they say high fever triggers convulsion, so is it really the fever that triggers the convulsion, or is there an underlying ailment or whatever is underlying to it that may trigger it?
Yeah. So two different things. I know when it comes to fevers, we're usually worried about the height, like you mentioned. And a lot of people talk about the fever that causes brain damage. But there's so many studies done. The fever that's actually high enough to cause brain damage or even possible brain disease, that's going up to what we call like 108 Fahrenheit or like 42 degrees centigrade. Anything lower than that is just that some people's bodies are prone to have higher fevers versus others. So it doesn't necessarily mean that having higher fevers means it's bad. It's about, one, what's the cause of the fever and what are the other things the child, what other symptoms they have and how do they look? So those are the three main things we look at. And then when it comes to convulsion, so there's been like a lot of back and forth studies done before. Initially, they said it's high fevers. They found it wasn't true, that even kids with fevers as low as 38 versus 42 can still have febrile convulsions. And then they said, okay, it's how fast it rises. And now the discussion is that we're unsure what actually causes those febrile convulsions to happen. We don't think it's a height of the fevers because those lower can have it. And we're not sure if it's how fast it rises. What we know is, one, there are some people that are genetically prone to having febrile convulsion, which means it kind of runs in the family. So let's say there are 5 children. If one of them has it, another one might have it in the family. Does that mean that one more person might have it? We don't know. We just know it runs in the family, then the possibility of having it. But so now, based on that, a lot of parents might treat a fever once they notice that you're having fever to prevent the convulsion, but it's still not 100%. You can treat your child's fever and they still have febrile convulsions, and that's still okay because we don't know if it stops it or not. Because a lot of kids, you may not even know they're about to have a fever until they have the convulsion because their body is already working on it. And then you check them, then you realize they have a fever. So because I have a lot of parents that feel bad and say, I should have treated the fever, but it's not their fault because the child didn't manifest the symptom till they had the febrile convulsion. And then you now check their temperature and they have the fever. But the good thing we consider that is febrile convulsion is one of the most benign, which is mild form of convulsion that kids have because they outgrow it. And a lot of them have no other seizures as they grow, unless it's the ones that have like multiple seizures within a short period of time, which we call complex. And it just keeps going and going that their brain does not recover in between seizures. But a lot of the kids between 6 months and 5 years that have febrile seizures have nothing else and they do well.